before disasters, after disasters, and during disasters, of course, marginalized and frontline communities suffer the most. And if we're going to change that, we need to be very intentional and dedicate resources and support to mitigate the loss of life, injuries, and other negative impacts to those marginalized and frontline communities.
I'm bringing my expertise and knowledge around health equity, having formerly been the director of the Office of Health Equity for the Virginia Department of Health, to the emergency management side, which is super important, and also helping under the leadership of Director Curtis Brown, helping that agency really fully embrace equity.
My time working with VDM and working with the Office of Diversity and Equity and Inclusion has been amazing. It has allowed me to create community partnership. It has allowed me to work with key stakeholders, and it has allowed me to acquire resources from them. It has allowed them to acquire resources for us, and it allowed us to address everything in a collaborative way. Talking to some of the individuals in the community, they expressed that they didn't have any opportunity to get out and get any hand sanitizer, or they simply couldn't even afford a mask. So seeing us come and knock on their door and provide them with free supplies and an educational outlet for them to understand what COVID is and how it's transmitted was a sigh of relief for many. And I just want to continue those efforts through the Richmond Fire Department and through the Commonwealth of Virginia through collaborative efforts.
We participate near weekly with, it's called the Unified Command Center. So we have, the Chesapeake Department of Health, the City of Chesapeake, to include, the Office of Emergency Management. The media reported that Virginia was 49th in the nation, in terms of administering vaccine doses. So the message came down, from the governor's office: get the vaccine in people's arms. We want done safely, equitably, and quickly.
To me, it's diversity, equity, inclusion, and accessibility. Because if you don't have accessibility, then it's difficult to include someone or make them feel that they've been treated equitably. People who do not speak English as their first language, those who are extremely economically disadvantaged, especially homeless populations, people who don't have access to transportation, pregnant women who are particularly vulnerable, health-wise, children under a certain age, and elderly and people who have chronic health conditions.
It has life-saving implications that some of these communities have never received resource, have never been considered. It cannot be overstated enough how important that was to laying just a foundation of the fact that, look, we are going to talk about equity, and we are going to consider diversity, equity, and inclusion in this response and in this recovery.
Is adjusting our practices to fully engage and involve the community, for government to go to the community versus the community coming to government. And as I think about the health pilot project that was developed by Dr. Lauren Powell and implemented across the Commonwealth, it directly related to that concept: equitable governmental policies and practices